Hello and welcome. Today, we're diving into a lesser-known but important topic, bladder lymphoma. We'll explore what it is, what causes it, how it's diagnosed and treated, and what the future holds for those affected by this condition. Let's begin unraveling the complexities of bladder lymphoma. The exact causes of bladder lymphoma, like many cancers, are not fully understood. However, several factors are thought to increase the risk. These include chronic bladder inflammation or irritation, such as from recurrent urinary tract infections or bladder stones. Individuals with compromised immune systems, such as those with HIV/AIDS or those taking immunosuppressant medications after organ transplantation, are also at a higher risk. While some genetic predispositions may play a role, bladder lymphoma is generally not considered a hereditary disease. Further research is ongoing to pinpoint the precise triggers and risk factors. Bladder lymphoma arises when lymphocytes, a type of white blood cell that normally fights infection, undergo malignant transformation. These cancerous lymphocytes then accumulate within the bladder wall. This accumulation can manifest as a mass, thickening of the bladder wall, or even diffuse infiltration. The presence of these malignant cells disrupts the normal function of the bladder, leading to various signs and symptoms. Unlike bladder cancer arising from epithelial cells lining the bladder, bladder lymphoma originates from the lymphatic tissue within the bladder itself. Bladder lymphoma is a relatively rare malignancy, accounting for a small percentage of all bladder cancers. Precise epidemiological data is limited due to its infrequent occurrence. However, it tends to be more common in older adults, typically those over the age of 60. Men and women are affected relatively equally. Because of its rarity, it can sometimes be initially misdiagnosed as other more common bladder conditions, highlighting the importance of accurate diagnostic procedures. The symptoms of bladder lymphoma can vary depending on the extent and location of the lymphoma within the bladder. Common symptoms include hematuria, or blood in the urine, frequent urination, even when the bladder is not full, urgency, a sudden and strong need to urinate, and dysuria, or painful urination. Some individuals may also experience lower abdominal pain or pelvic discomfort. In advanced cases, if the lymphoma spreads beyond the bladder, symptoms such as weight loss, fatigue, and swollen lymph nodes may also be present. It is crucial to consult a healthcare professional if you experience any of these symptoms, especially hematuria, as it can be indicative of various bladder conditions. Diagnosing bladder lymphoma requires a thorough evaluation. This typically begins with a physical examination and a review of the patient's medical history. A urine analysis is performed to detect the presence of blood or other abnormalities. Cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the bladder, allows the doctor to visualize the bladder lining and identify any suspicious areas. A biopsy, where a small tissue sample is taken during cystoscopy, is essential for confirming the diagnosis. The biopsy sample is then examined under a microscope by a pathologist to identify cancerous lymphoma cells. Imaging studies, such as CT scans or MRI scans, are used to determine the extent of the lymphoma and whether it has spread to other areas of the body. Bladder lymphomas are primarily classified based on the specific type of lymphoma cells involved. The most common type is diffuse large B-cell lymphoma DLBCL, a type of non-Hodgkin lymphoma. Other less common types include marginal zone lymphoma and follicular lymphoma. The specific type of lymphoma is determined by examining the biopsy sample under a microscope and using special stains to identify the proteins on the surface of the lymphoma cells. Accurate classification is critical because different types of lymphoma may respond differently to treatment. Treatment for bladder lymphoma depends on several factors, including the type and stage of the lymphoma, the patient's overall health, and personal preferences. Chemotherapy is the mainstay of treatment for most types of bladder lymphoma. This involves using drugs to kill cancer cells throughout the body. In some cases, radiation therapy may be used to target specific areas of the bladder. Immunotherapy, which uses the body's own immune system to fight cancer, is also becoming an increasingly important treatment option. In rare cases, surgery may be necessary to remove part or all of the bladder. Often, a combination of these treatments is used to achieve the best possible outcome. Close monitoring and follow-up are essential to detect any recurrence of the lymphoma. Currently, there are no definitive ways to prevent bladder lymphoma. However, certain lifestyle choices can contribute to overall bladder health. Staying well hydrated by drinking plenty of water helps to flush out toxins and reduce the risk of bladder irritation. Prompt treatment of urinary tract infections can prevent chronic bladder inflammation. Avoiding smoking is also crucial, as smoking is a known risk factor for many types of cancer, including bladder cancer. Individuals with weakened immune systems should work closely with their healthcare providers to manage their underlying conditions and minimize the risk of infections. The prognosis for bladder lymphoma varies depending on the type and stage of the lymphoma, as well as the patient's overall health and response to treatment. In general, early-stage lymphomas have a better prognosis than advanced-stage lymphomas. With appropriate treatment, many patients with bladder lymphoma can achieve long-term remission. Recent research has focused on developing new and more effective therapies for bladder lymphoma, including targeted therapies and immunotherapies. These advances offer hope for improved outcomes for patients with this rare malignancy. Furthermore, ongoing clinical trials are exploring novel treatment strategies and combinations to further enhance the effectiveness of bladder lymphoma treatment.